Welcome to Unmasking the Trans Movement with John Mueller. I'm your host, Brad Wilder. Great to have everybody on board today. John is back with none other than Jenny Kyng. Part 1 really took us through a great deal of information on gender affirmation, and they're going to continue that discussion here today. We'll be back with Unmasking the Trans Movement right after these. In this age of gender confusion, it's difficult to find advice you can trust to help protect your child from those who would seek to unduly influence them, setting them up to be manipulated and exploited. On Unmasking the Trans Movement, we discuss, educate, and deliver the info parents want and need to help their children, grandchildren, and even themselves. Each week, we connect you with the clinical professionals and subject matter experts who understand what this movement is all about and how to navigate around this disturbing mental health issue. Join unmaskingthetransmovement.com for our next webinar, where John Mueller, Dr. Ann Gillies, and our clinical experts provide the advice you can trust to help protect your child from those who would seek to unduly influence them and set them up to be manipulated and exploited within the trans movement. Our webinars provide access to supporting groups discussing the issues you want to talk about with other parents and experts alike. Learn to understand how the language has changed, stay up to date on this new lingo, and be able to have a rational, understanding conversation with your child who might be getting dragged into, sorry for the pun, this evil trans agenda. Our mission is clear: to unmask the deception and protect the most vulnerable among us. For webinar dates, times, and pricing, please visit our website at unmaskingthetransmovement.com/webinars. Welcome back. On Unmasking the Trans Movement last time, John Mueller and Jenny Kyng sat down and discussed gender affirmation. John is with us right now. John, great to have you back on the program for part number 2. And Jenny is going to also be here with another world of information. She is a real treasure trove of what this movement is really all about.
Brad, thank you. We do have Jenny Kyng back. Jenny, thank you so much. Straight from Tasmania, from down under. Jenny has proven to be a wealth of knowledge, just a repository of clinical facts and details. Jenny has a RN background as well as has been a psychotherapist, worked with a wide variety of clientele and patients, not the least of which are those that have wrestled with eating disorders, and that is very applicable for any discussion dealing with gender confused kids, because so many of them have a multiplicity of co-occurring disorders, so to speak. That usually has to do with drug and alcohol, but comorbidities. And so, Jenny, welcome back. We're gonna pick up where we left off. I'm encouraging people to go back to part 1 of this episode, as well as a previous episode, number 5, dealing with the facts of gender affirming care, the dangers of that, and then we were speaking about the dangers of the affirmation model, and we're going to pick up where we left off. Jenny, anything from last time that you want to reiterate or to bring up again, as we're then going to look into some of the realities of this gender affirming care and the affirmation model?
I would just reiterate that affirmation is a completely unscientific and completely unique approach in science, medicine, or psychotherapy. We don't do it with any other form of problem that presents itself to us. It's completely unique, and it goes against every principle of science. And I'd also just like to add that this whole gender transition mass movement is an experiment. It's an experiment that's undeclared, and it's an experiment that's unregulated, and it actually violates every single principle of the Nuremberg Code, which was written after the Nazi atrocities after World War II to ensure that no atrocious medical experiments could proceed as they did under that regime ever again. And yet here we are. So yeah, I just leave it at that as a sort of recap of my major concerns.
And that is so applicable, because one of the huge concerns that we have is the issue of informed consent. That if you are going to be subjected to or give consent to some treatment, including psychological treatment, you have to be fully informed, and that has to do with being provided enough accurate information, complete information, so that the person can make an informed decision. That has to do with a couple of things. One, can they comprehend what you're saying? Do they? Are you describing things in a way that they can really understand this whole thing, and then apprehend? Do they really understand the meaning and the implications of what is being suggested to them or what is being affirmed? And when it comes to anybody that is emotionally troubled, psychologically or emotionally, and then a young person, then a teenager, right? We have age limits when it comes to drinking and driving and voting. We understand that because kids are immature, but this is the only thing that we've ever seen, Jenny, that when it comes to kids of any age, we're just going to allow them to, we're going to affirm this decision, so they clearly have been manipulated or impressed upon from the outside in. And this affirmation has to do with, we're going to set them on a pathway toward the medicalization of their bodies. Describe for people what that is, and then we're going to look at some pictures, and people need to be forewarned. But you know what? If we're pushing this, if people are pushing this, you might as well see what's being pushed on these kids.
Exactly. Pictures cut through all the rhetoric and propaganda. But the thing about affirmation is that it gets kids in very early, from as early as 3 years old. So you get them on the trans train as early as possible, because everyone who's socially transitioned, that is, called by a different name, treated as if they're a different sex and dressed up as a different sex, almost everyone who starts that, even as early as 3, goes on to medical transition. It's almost inevitable. So that it's a great way to get your experimental subjects in as early as possible. And the other big cohort is adolescent girls, who are in a state of extreme emotional flux, because that's normal at puberty for girls. So you're getting people in as vulnerable as possible. So it's such a con. It's really it's outrageous. What can I say? It's so outrageous. So then you're getting them on this pathway to appalling medical abuses. Just to say also that the Nuremberg Code also insists that people be told that they're being subjected to an experiment, and that is not happening with this mass experiment. People are not being told, children are not being told, this is an experiment. No one gets told that. They're told, oh yes, this is the only way. If you don't do this, you will commit suicide, which is an extraordinary message that we've never used in psychiatry, psychology, counseling, or medicine ever before. So whichever way you look at it, it's just extraordinarily unusual, unethical, unjustifiable, and diabolical. And I'm not exaggerating. That is what it is. It is diabolical.
And this, absolutely, it's totally diabolical. And it is cult-like.
It is cult-like. Absolutely cult-like. And the whole idea of affirmation, it's kind of like confirmation. You're going to be inhabited by the gender Holy Spirit or something. It belongs, that idea of, confirmation, that's very appropriate in a religion. It's not appropriate in science. It's a violation of scientific principles. And yes, it leads to horrific medical consequences, such as the kind that you're going to show us now, which they are horrifying. When I've shown people these pictures, they didn't believe them. But this is what is happening. So people need to know, what does it really mean beyond all the flowery rhetoric and the beautiful unicorns and, rainbows and everything? What's actually happening? People need to see that.
If this is what, really in a nutshell, this is where these kids are ending, because the trans movement is it's a moving sidewalk. Right. So wherever the kids get onto the sidewalk, and it starts with pronouns, it starts with the social transitioning, it starts with the term non-binary, which is another way of saying there's not male or female. Yes. So we dispense with reality testing, which is our intuition as well. We used to use the term biology 101, meaning self-evident. There's not much more self-evident things than XX and XY chromosomes. Yes. And what's, the old phrase, kind of what's between your legs, or what, male and female.
Yeah, that's fundamental.
So if we can get somebody to disbelieve or discount or say, I know what it looks like, but it's really not that, they've
Yeah,
dispensed with reality testing, and therefore any
yeah,
fast talking individual that comes along, whether snake oil salesman, it used to be an old
yeah,
fashioned term, or a cult leader or a manipulator, it's all
yes,
manipulation, then someone who's had their uh, intuition dumbed down, right, where they don't
yeah,
trust their intuition, and two populations are sexual abuse survivors and kids on the autism spectrum. They are easily persuaded into believing that something that isn't true is true, and vice versa, such as they're born in the
exactly.
wrong body.
Exactly, which is not in any medical book. There's no such diagnosis as born in the wrong body syndrome. But yes, once we start disregarding reality, we're in grave trouble as a society and in all the important institutions in society. When we disregard reality, we're on a pathway to psychosis. And there's going to be a lot of victims, and there are already a lot of victims. And as Jordan Peterson says, confusing children about sex, which is as fundamental as anything can be, is no less disorienting than confusing them about the difference between up and down. You know, we're confusing children about fundamental aspects of reality, and that is child abuse in itself.
That's right. And you mentioned last time, before we start to look at the pictures, and people need to be able to see what this is. We're going to show you the heart of the trans movement.
Yep.
Well, one thing you mentioned, which was so crucial, is that if a kid undergoes these procedures, as they grow up, they not only will be sterilized, but they will have no sexual function or feeling or sensation. So you have robbed them of any sort of sexuality in terms of sexual pleasure, which the body was designed to experience that.
Well, that's right. Many of them will have no sexual pleasure, and many of them will actually have pain on sex. For instance, there are girls who've been put on testosterone whose vagina becomes so atrophied, that is, the tissue starts to get really thin and dried out like an old woman, who've had sex and started hemorrhaging because the tissue is so fragile, you know, and they've had acute pain and they've started hemorrhaging. I mean, how is this good for anyone's mental health or physical health? It's just it's madness. That's the only word I can find for it. It is madness. But it's like mad is the new sane in the world we live in. We're living in an upside down world where you can't point out that these things are dangerous and diabolical.
There we go. Okay, so we're gonna look at the reality of the trans deception, trans movement. And again, they've captured the language. So, you know, this anti-conversion therapy, the best way to understand that is, if a cult draws your child away from you as the parent, they will say that your child is now theirs. Your child doesn't belong to you anymore, right? It's part of the new community or family. And if that child attempts to leave the cult or have somebody that is speaking truth, because every cult will limit outside information. If a child begins to leave the cult leaders will decry, somebody has converted our child, our community member, the person out of our movement. So they flip the language. So we are not advocating conversion therapy, and that's a silly thing anyways. Therapists don't do that. But our concerns, number of concerns, but when it comes to this movement, it starts to cause, not starts to, it requires a mandated reporter not to be able to discern the indicators of sexual abuse and trauma. So we're going to look at that now, as well as a mandated reporter cannot be protective as they should be, because, and other people, including school teachers who are mandated reporters, but they then begin to not discern friend versus foe as far as who is having designs upon these children. And you can have two kind of predators. One is a financial predator, the other is a sexual predator. Financial predator is someone that is using you for their own bank account. So we're now going to look at, and we'll start with what I challenge people, and a lot of these posts come from my own social media posts. We're going to share the screen now. I'm going to bring this up. We have this on a Word document just for purposes of sharing now. Okay, so I ask people, how old do you think this young girl is? Right. Let's start with the age. Now look at this surgeon. Oh, he's happy. We got thumbs up. And by the way, look at this is obviously somebody who is doing liposuction. This is a surgeon, but he's operating on what age of a young person? I happen to know the age because this young girl's aunt was standing outside of this clinic with a billboard saying this doctor has whacked off the breasts of my niece. Okay, and so I can tell you this young person is pretty young. So
how old is she, John?
I'm sorry?
How old is she?
She's actually just about 16. So she still
right.
looks very young for her age, but most people assume she's like 13.
Yeah.
And so my comment, of course, to the to WPATH is somebody okay with this? So this surgeon male, and this guy was from Canada, by the way. I think he went down to Florida, but my guess is now he has moved. Okay, we're going to scroll down here. Okay, Jenny, talk to us. Of course, I ask on social media, you turn a blind eye to this. Welcome to the end of the line of the trans deception, meaning this is the end of the line. Sterilization, amputated and left with even more scars than were there, which were self-inflicted from trauma. Wonder if the doctor saw the scars prior to slicing off her breasts.
Right. Well, this is the ultimate in self-harm, and this is collaborating with self-harm in a way that the patient could never do herself. She could try to cut off her own breasts, but she would probably bleed to death. And most people aren't willing to go to that extent when they're self-harming, because they're usually self-harming to reduce their emotional pain. So they would never, or very rarely, go to the extent of actually amputating a body part. And yet now we have surgeons who are willing to collaborate in this extreme escalation of self-harm and amputate healthy body parts in a person who clearly suffers from extreme emotional distress, and I would say almost certainly trauma, almost certainly sexual trauma, because self-harm like that is usually seen in people with borderline personality disorder, which is usually associated with trauma, sexual trauma, interpersonal, emotional trauma. So it's absolutely inexcusable. It's criminal.
Yeah, 100%.
Surgeons should be put in jail.
That's right. Right. This is done in a dissociative state. And what I ask people is this: you see all these scars. This young lady made these. These are all self-injurious scars, and so is this one.
Yep.
So are these. So I first ask: is this young lady left or right-handed?
Left-handed.
Right. Right. Actually, I'm going to suggest this hand did these over here.
Yeah.
Yeah.
You notice there's nothing over here. But here's what's profound. The question is this: we have scars that meet. Which scars were there first?
Right. Well, you can see that the self-harm scars. Not
this scar. That's right. So this surgeon had to cut through these scars. So during the initial eval and assessment, physical assessment that a doctor does, this doctor saw these scars.
Exactly.
And went ahead.
Seen them.
Right.
They're very old scars.
That's exactly right. Okay, we're going to move down. Oh, and here's one down there. So you probably have some near the abdomen, probably also on the inside of the thighs. Here we go with another one. This is Dr. Gallagher, who is in Miami, but no one can find Dr. Gallagher. I think she left with her multi-million-dollar yacht.
Right.
Okay, so we have another situation. Here's a young gal that had her breasts removed. And notice on her body, I'm going to increase these. Okay, we're going to start to look at, and the first question I ask again is she left-handed or right-handed?
Looks like left-handed. Oh, no, right-handed.
Right.
She's right, because there are no scars here. So the right hand would be the thing to use. Now, we have superficial and non-superficial. None of these really meet the criteria for superficial, quite frankly. A lot of people think that these are stretch marks. These are not stretch marks.
Certainly not.
These are the same kind of marks that are here and here. And then we've got some really severe ones right in here.
Yep.
You've got some really severe ones here. And then there's one right there, and
Yep.
then, of course, right here. What do we call
Yep.
that? If we were to see a young person with scars, and this is always the most lethal, if we saw a young person with scars on her wrist, what would we think she is?
Suicidal tendencies.
Possibly suicidal.
There we go. And so you take a severely emotionally disturbed kid and you're going to do what?
Yeah, exactly. Well,
For
the thing is, these
$40,000
surgeons,
or 40,000 bucks.
doctors, they justify themselves by saying, well, she's suicidal because she's got gender dysphoria. So they have a self-justifying rationale that is never subjected to any normal scrutiny. Everything comes down to gender dysphoria, and that licenses them to do whatever they like to these children.
Right. And the fact that this was done in a dissociative state, this young person will have multiple indicators in terms of psychiatric diagnoses that would indicate that this young girl has been sexually perped on. Okay, we're going to scroll down.
So this surgeon isn't obligated to go and get the mental health treatment. They can just go ahead and start cutting away and not even worry about the mental side of this?
Correct.
There's no real mental health assessment under the affirmation model because it's not real psychotherapy or assessment. If you're affirming, you're not asking any questions. You're not doing assessment. Assessment is asking questions. But if you have to just say, yes, you're right, that's not asking questions. You're not really allowed to assess properly. So assessment is a complete joke.
And this is what's supposed to help a young person. Now, do we know what are under these scars? We certainly don't know anything about her. Sometimes young people will end up doing tattoos over scars, but we don't know. But do we really think that this is going to benefit this young lady? Now, Jenny, describe what this is.
Okay, so this is a graft site. So they've removed tissue and flesh from the forearm.
Scott Nugent has gone through this, correct?
Yes, he has. And he lost feeling and function in his arm. There have been some people who've had to have their arm amputated because it became infected. So they've removed flesh from her forearm in order to turn it into a sort of sausage that they're then going to attach to her genital region to emulate.
Now, I'm sorry for interrupting, Jenny. What we've seen thus far is what's called top surgery, right?
Yes.
And so cults, manipulators will not use accurate language. These are double mastectomies. So when a girl says she's collecting money on the internet, GoFundMe for top surgery, this is what they're talking about. This is a double mastectomy. Why don't surgeons call it such? Now we're going for female bottom surgery, which requires a skin graft either from the arm or the thigh.
Thigh. Sometimes they seem to do it with abdominal tissue too. I'm not quite sure how that works, but
okay,
yeah.
Here's another view of it. Folks,
yeah,
this is what we're advocating for girls, supposedly. Those that are pushing this diabolical thing. You think this is beneficial?
Yep. And it marks you for life. It's obvious to everyone that you've done something horrific to yourself. And I know that for some self-harmers, they want everyone to see their self-harm. They want to display it. And unfortunately, later on in life, they go, oh my God, I don't want all these self-harm scars showing. But this is beyond self-harm scars. This is self-mutilation assisted by a surgeon. It's just disgusting.
That's right. So we already have seen top surgery. Then the next stage will be bottom surgery for women. Again, this is a complete oophorectomy. And then they're going to go for, what's the term? Because now we're going to show, folks, this is the trans movement. This is what's being foisted upon kids that we're not supposed to suggest to any young person. You know, has anybody really shown you, is this going to work for you? Is this going to, you're not only going to be sterilized, your family tree is over at this point, but is this something that's going to enhance your overall satisfaction in life? So what are we now going to see? Because the next picture is exactly where this skin is going to go.
Yes. So what we're going to see is a phalloplasty, phallo for penis.
This is what they're pushing on girls.
Yep, that is created from the tissue of her thigh. In this case, they've used her thigh tissue, probably because she's so skinny, she doesn't have enough tissue on her forearm. So they've gone for the thigh. They've created a horrific scar where they've flayed the tissue of her thigh, and they've turned it into this absurd-looking pretend penis that looks like a battering ram and which will not function as a penis and which has a 67% complication rate.
As a matter of fact, look at how much skin. Look at how much skin, Jenny, they already had to take off.
There's no nerve endings in here for them to be sexually stimulated, is there?
Well, supposedly they take some of the clitoral tissue from the vagina that they often sew up and attach it to the end of the fake penis. But whether that really works or not is anyone's guess. From what I understand, it usually doesn't.
There's no erection involved here either, is there, Jenny?
There's no natural erection, but they can give you this sort of implant of a kind of like device that will pump up.
Really?
But yeah, no, it's all artificial. It's completely artificial. It's cosmetic surgery. It's Frankenstein surgery, quite frankly.
Yeah, very disturbing.
Create the look.
Okay,
yeah,
so,
all you're doing is creating the look, but it doesn't even look like a real penis.
You know, this is transgender care. Okay, this is diabolical. Now, we're going to show people how this entire...
This is what they want to do to your kids, everyone. This is what they want to do to your kids. Keep your kids away from this crap.
Okay, now...
And they're not even letting you know about all the horrific problems like ending up with a colostomy bag, ending up with a urinary catheter, ending up with chronic urinary tract infections, ending up with sepsis, which is blood poisoning through infection. And I could go on. The complications of this procedure are huge and they're horrific.
Oh, gosh. Okay. Now, I want people to see when we say this did not exist prior to 2005. Here's 2005 numbers. Now, okay, a little blip. Why? Because you had social media stuff. But as far as referrals, okay, and where is this one to? This is Wellington. Okay, but look at the numbers. Okay, 5. Okay. But prior to that, can we go back in history to a point where there was 0 correct? So
if you read,
I'm sorry, Jenny?
Oh, sorry, you go ahead.
So you had RuPaul did his program. The launch of his program was about 2009, right in here. Okay, so that's attributable to RuPaul. The DSM-5 allowed all of this to be billable. And wherever you go, as far as on the internet, looking at referrals for these kind of surgeries, it's 2013 that suddenly the spike. So without exception. So Jenny, any question? Because now we're going to look at what are the implications. We certainly have just looked at informed consent. My guess is kids are not being shown these kind of pictures. So we are withholding accurate information or full information from these kids so they really can have a sense of what they're in store for, or who has somebody in store, what somebody has in store for them. But then we're going to look at now the concerns also of predation, that this dumbs down the adults around these children to be able to meaningfully discern who is gaining access to these kids. There's what's called a gay and straight alliance after school safe space kind of club. And the question is this: if I'm a mandated reporter and I'm showing these pictures, and let's say these little boys, and that's who these are, by the way, these are little boys. And if you found as a teacher or a therapist that during session or during class, our little student or little client takes out a picture like this or 2 pictures saying, my Uncle Jim and I had fun the other day over the weekend. Oh, what did you do? Oh, we did this. And well, he's really not my uncle. He's my mom's boyfriend. I just call him uncle. And he stays with me when my mom goes on trips, on business trips. And we play dress up. The question is, would somebody have a problem finding out that an adult male, these are 2 men, by the way, the one on the right was on RuPaul Drag Race, would this constitute a mandated report? And if these 2 men aren't sexual grooming, what rises to the occasion of sexual grooming?
Absolutely.
So are these artists or are these men that have accessed porn on a regular basis, especially the night before, and now they are starting to act out what they've been watching. So
Exactly.
you watch online, when you pose this, when I pose this on social media, you have people that are saying, "Oh, John, you're reading into it too much," and they normalize this. Let me see, the guy on the left, guy on the right, I wonder if they could actually get naked with these kids. Oh, I'm sorry,
definitely.
they are. So we don't have problems with men getting naked with other people's kids like this.
Right. Well, the narrative is that anyone who's gender queer, which is a ridiculous expression, or trans, is some sort of saint who no one can even consider could be a predator. You're not allowed to even consider that because that makes you transphobic, because they're a sort of sacred caste in society.
And they certainly don't look at pornography.
The way priests used to be viewed.
That's right. They certainly don't look at pornography, right? Because any guy does this without looking at pornography.
We're going to need a jail system, you guys, that's going to house these individuals who are pedophiles like this in the future, because I tell you what, you put them in main population in any other jurisdiction in the southern states and they're dead. You know it and I know it. They will not make it a day in jail.
There we go.
The trouble is, Brad, they go to women's prisons.
They can call that trouble, but bottom line is I can think of a lot of women who will beat the hell out of those guys just as much.
Right. Okay, now, Jenny, in the interest of time, what we talked about was not only does it dumb down mandated reporters' ability to keep kids safe from by being able to spot potential threats. These guys are potential threats. They are naked with other people's kids. Okay, so I don't know how much more blatant it can be that these guys are accessing porn. Thank you very much. And what kind of porn?
What would you do if you walked into a bedroom and that was your daughter sitting there with that guy? Think about it that way. That's the plain and simple truth. It doesn't matter whether it's at school, at a church, or at a local coffee shop with this drag story stuff. This is the reality.
That's it. Now the other concern is if these kids were being okay, so they spend a lot of time with these men, and let's say we start to see these symptoms. Jenny, let's talk about these. These are the
Absolutely.
red flag clinical indicators of sexual trauma and grooming and exploitation. Jenny,
Absolutely.
let's walk through some of these. Have you ever seen some of these in your practice with kids that have been sexually abused? But now with the affirmation model, we're not supposed to look into these issues.
Exactly, John. And the study that was done into adverse childhood experiences and their relationship to later mental health problems showed categorically that sexual abuse was the most reliable indicator that people would end up with any of these problems, as well as a lot of medical problems. So yes, all of these can most certainly be associated with childhood sexual abuse. And, some of the ones that really stand out for me are things like panic attacks, self-injurious behaviors. So self-harm is a pretty strong indicator of some sort of abuse in many cases. Not always, because it's also a social contagion that spreads from child to child. But it can certainly be an indicator of borderline personality disorder. It's a cardinal sign of borderline personality disorder, which is most often associated with childhood abuse, mostly childhood sexual abuse, as well as emotional abuse. So hating one's body or not wanting to be the gender that's being targeted by the abuser, that's such a red flag. And yet it's not looked into at all. It's just assumed that you have this mystical thing called a gender identity, which does not exist. It's completely absurd on the face of it, and it was invented by a pedophile psychologist, John Money. So this is the problem we have when we dispense with reality. We start to believe in fairy tales, and we cease to believe in things that actually matter and are real, like the fact that children are being abused. Dissociation, that goes very strongly with sexual abuse. Eating disorders, very strong connection to sexual abuse. Compulsions, addictions, all of them, like, oppositional defiant disorder. As I said, borderline personality disorder and histrionic personality disorder. Stephanie Wynn, who's a therapist, who's gender critical, said recently that studies have shown that 82% of people with gender dysphoria have borderline personality disorder or narcissistic personality disorder. And both of those are born in trauma most frequently. So delusional disorder, once upon a time, we accepted that some people were delusional And we would have considered the idea that you're born in the wrong body to be a delusion. But now you're not allowed to say that. And, you know, you're not even allowed to think it, at least not speak about it. Otherwise, you will be pilloried as transphobic and even a Nazi. This is the way that the trans movement intimidates and silences critics by shaming people and condemning them.
Jenny, would it be safe to say that if a child who has, and we saw some of those pictures of the kids that had undergone, the minors that had undergone, or young ladies that had undergone double mastectomies just a bit ago, is it safe to say that the ones that we saw in those pictures, let alone how, you know, just many, that we would also see underlying depression, anxiety, panic attacks, self-injurious behaviors, dissociation, you're dissociating if you can cut on yourself to that extent, eating disorders, bipolar and borderline personality disorder?
Guaranteed. Something like 80% of people who present for so-called gender-affirming care have an array of mental health problems, including amongst this list, very, very commonly. And usually they have more than one. Usually they have about 4 or 5.
So by the time somebody, a young person, is depressed, anxious, has panic attacks, self-injurious behaviors, they hate their own body, dissociation, eating disorders, bipolar, borderline personality disorder, is it fairly safe to say that you may have a young person who is potentially suicidal?
Absolutely. That's suicidal ideation, at least, and suicide attempts.
So when we are told that these young people are suicidal, is it because of gender, that they can't change, can't have a sex change, or could it be they're suicidal because because of trauma, somebody likely has been perping on them?
Well, trauma of all kinds, and all of these mental health problems. And the reality is that trans teenagers and kids have the same suicide rate, completed suicide rate, as any kid with these mental health problems. It's no different. And we can boil it down to kids with emotional problems. We don't need the gender bit to explain why they have these suicidal thoughts and feelings and why they have suicide attempt rates that are high. It's exactly the same as the same population without gender dysphoria who have all of these mental health or some of these mental health problems.
Do we see any increases in regards to the mental health hospitals that are helping patients? Have we seen an increase in transgender or detransitioning individuals showing up to get the help that they need from the hospitals? And are they even providing that help?
I'm not aware of statistics on that. Here in Tasmania, we're possibly a bit behind because they'd probably go to the mainland of Australia rather than Tasmania. But certainly, I think in the US, kids are showing up in psychiatric hospitals and then they're being diagnosed, you know, again, their diagnosis of gender dysphoria is confirmed and no one ever says, well, she's on testosterone. That's probably why she's so agitated, angry, has this uncontrollable sex drive and is now self-harming when she's never self-harmed before. So again, there's a blockage of any genuine questioning because everything must be seen through the lens of gender dysphoria. So yes, these kids are turning up in hospitals, psychiatric hospitals, but they're not getting the treatment they need. And quite a few detransitioners will tell you that, like Helen Kirshner. She ended up in a psychiatric hospital. Testosterone had a terrible effect on her. And then she just ended up, if I'm getting her story right, on a lot of psychiatric meds, like 5 different psych meds.
How much of this leads to suicide, guys?
There is a study, a long-term study, showing that after 20 years, the suicide rate increases to 19 times that of age and mental health matched populations. So it massively increases your risk of suicide over time, but it takes, 8 to 10 to 20 years. But, when you're working on someone who's only 13, 20 years down the track, they're not that old. They're only 33 and their life has been potentially destroyed. And
confusing. Very, very confusing. Such confusion that I can't imagine what somebody's going through, especially if you're somebody who's got maybe obsessive compulsive disorder and right. Now you're going through a gamut of that. Like you said, there's more comorbidities than just one. And that being said, it's mind-boggling to think that we can actually help people and bring them back. and
That's right.
the effort that
ignoring
needs
all
to be
the things
taken.
they need help with. Sorry, Brad, what did you say?
I was just going to say that effort that needs to be taken and that put forthright, like it's a challenge all the way around. It's a challenge from the doctor's perspective to try to help. It's a challenge from the therapist, whether it's, a mental therapist, or, from the patient's point of view, which is, I'm really, really now even more so confused because what I thought to be reality isn't. You've just exposed me to that. And wow, like overwhelming, just like, and again, leading back to the drugs, leading back to the sedation, leading back to harming themselves. And what a revolving circle. And that's what I wanted to bring up was this circle. It just keeps, it's like a revolving door in a hotel. It just keeps going around and around. And, you get off for a bit and then somebody pushes you back on and you're going again.
Exactly. Well, a lot of these detransitioners, Brad, find they get no help from the therapists who are supposedly there to help them. They don't want to know about them. They are rejected. They're rejected by their peers. They're rejected by their cult, and they're rejected by all the activist doctors and therapists. And they have huge amount of trouble getting help.
So they're left hanging.
And it's not just detransitioners either. You've got a lot of unhappy transitioners who can't go through the process of detransition, but they're not happy with what they did, but they just can't imagine going through it because it's too much trauma for them. But they're stuck on hormones for the rest of their life. So they're patients for life.
I'm having a hard time just understanding how a 13-year-old goes to their parents and says, I want a double mastectomy or I want to chop my penis off. That just for me blows my mind. And for a parent to say, all right, let's go, Sally, your little Johnny. Wow.
It's hard to understand. It's really hard to understand. But we've brainwashed the whole population, basically, into believing this is wonderful, progressive, caring, and loving. And anyone who criticizes it is not just wrong, but they're evil.
And you've pretty much now criminalized anybody that's going to suggest that this is not the best way to help people.
Absolutely. You've criminalized them, you've shamed them, you've silenced them. They don't get heard in the media. The mass media won't report any of this stuff.
Well, and Jenny, that's why we're very thankful that you're willing to come back. You're going to be coming back on a frequent basis. You are a great source of information. We're so appreciative of your time coming onto the program.
Pleasure to be here. Yeah, it's great talking to you guys.
Thank you. And Brad, thank you as always.
Thank you, John. Thank you, Jenny. It was a great show, both parts. One is very engaging. Two is, we'll say graphic, to say the least. And please don't forget to like, share, subscribe. You can catch us on our BitChute channel. Obviously, they're trying to take us down. That'll always happen to us. But we will bounce back. So if you can't find us there, you can also find us on unmaskingthetransmovement.com. So please make sure you stop in, take a look around, become a member. It doesn't cost a whole lot to become a member and learn everything you need to know on Unmasking the Trans Movement. I'm Brad Wilder for John Euler and Jenny Kyng. We'll see you next time. Remember, this isn't our kids' fight. This is our fight.